Hello and welcome. This is officially week 2 of HIM 130, and our course is going to help you learn a lot about very important part of the healthcare industry. And that is because health information management, and we're going to just health information management professionals are legally responsible for the inflow of money into the facility. Whether it is a physician's office, a clinic, or a big, huge hospital, the Health Information Management Department has total control of the revenue stream, which is what we call the inflow of money into a healthcare facility. So this makes the job of health information management more important. I mean, it's important already, okay, because we collect, protect, and analyze the data of what's going on with every single patient seen by every aspect of the healthcare facility. But in addition to that, we are also responsible for the income of money. We do our job poorly. This is particularly coders and billers. We do our job poorly, and the revenue stream becomes retarded. Okay? We're not getting in the money that we actually earned. Now, who's in favor of that? Nobody. Okay? So it's very important that HIM professionals do their job properly and accurately, and in particular to the money, we are talking about coders and billers. This is a big responsibility and underscores the need for HIM professionals of all levels, particularly coders and billers, to be very accurate. Now, when it comes to money, you know that it's kind of like a pendulum, okay? And the pendulum dead center is optimal reimbursement. That's you're bringing in the money that was actually legally properly earned, okay? The pendulum swings one way and you're getting money, but not the total amount you deserve because you're undercoding or you're leaving things out. Who wants to work and only get half of their paycheck when they work the whole time? Nobody. So it's the same thing. All right. Now, if the pendulum swings the other way, we may get more money than we actually deserve. And that brings us to this week's topic of fraud and abuse, for which you can go to jail or prison. So let's talk about the HIPAA Fraud and Abuse Program. It's actually, the full name is the Healthcare Fraud and Abuse Control Program. Now, this was set up to identify and be able to prosecute those who attempt or actually succeed in defrauding or abusing the financial aspects of the healthcare system, including Medicare and Medicaid patients and programs. Now, what you have to remember is illegal is illegal. So the federal government can only regulate this with regard to federal programs. But each individual state has a fraud and abuse control program, and not only Medicare and Medicaid, but every private health insurance company has a healthcare fraud task force. This also comes under the heading of the Department of Justice. as well as the Office of the Inspector General. So what am I trying to tell you here? What I'm trying to tell you is there's lots of eyes on this. And remember that claims are now submitted electronically, which means the first eyes to review a claim form are a computer's eyes, which are incredibly accurate. And what they will do is they will note an error. They will not pay for that. Now, that might be rejected. There's an error in the policy number or the way you spelled the patient's name or something like that. And that's a rejected claim, and that'll go back. And you can correct that and resubmit under the proper, protocols. All right. Then we have a denied claim, and a denied claim may be $0, or it may be we're going to pay you for this and this, but not this. So that means follow-up is very important, but there's something else that you need to be aware of, is that the computer will invisibly tag the claims from a particular facility that have little errors, okay? And the computer will continue to search every claim from that facility under that NPI, the National Provider Number Identifier, okay? So that is why it can take these legal these legal challenges so long, is because you may be sitting there and saying, well, what are you going to tell me if I make one little mistake? It's good. I'm a human. I make mistakes. What are you going to tell me? I'm automatically going to go to prison? No. And that's why it takes so long, is because the computer will send it back and it will say, you made this mistake. Now, if it was an innocent human error, you're going to fix that and not do it again. But if you continue to do that same mistake over and over and over the course of a year, that's when they have evidence of fraud or abuse. So I don't want you to get crazy about this, but I want you to understand when we tell you to double check, triple check before you submit, because we don't want you to get tagged and a year from now then be charged by the Department of Justice or the Office of the Inspector General or any one of the fraud task forces from any one of the third-party payers. Okay. Plus, you don't want to do it. It's wrong. It's stealing. Okay. All right. Now, another law that you should be very familiar with as an HIM, as an upcoming HIM professional, particularly with a specialty in coding and billing, is the False Claims Act, because this law was literally written for you, for your job. Okay. Now, the False Claims Act, the Federal False Claims Act, is a law that says that sending a claim to a third-party payer with false information to get money that you don't deserve is an illegal act. Okay. All right. So now there's no question about it. Yes, this is illegal. All right. Now, and I know that your textbook discusses this is a federal law. So it only, as I just talked about, it only pertains specifically to Medicare, Medicaid, TRICARE. Okay. But every single state has passed their own version of the Federal False Claims Act, the State False Claims Act, which makes it illegal to send a claim with false information on it to any third-party payer being licensed in the state. So you need to know that A, no matter who you're sending this claim to, you have to make sure that all the information is accurate. Okay. But second, understand if you are found guilty, this becomes a domino effect. And what I mean by that is if you're found guilty of the Federal False Claims Act, that will trigger whatever state you're in to do their own investigation and find you guilty of the state law as well. More fines, more penalties, more potential for jail or prison. Okay. And vice versa. If the state catches you first, they're going to hand you over to the feds. Okay. So whatever it is, that's a lot of computerized looking over your shoulder, looking at the claim forms you are creating. And you got to make sure that this is accurate. Okay. So you might say, well, how do I know? Well, first of all, you have to be following all the guidelines for coding, right? Okay. But, and this is one thing that I love about this, the way this law was written, there is a knowledge requirement in the False Claims Act. And it says that someone is guilty if they know or should know that an item is false on that claim form. Okay. Now, there are 3 different types of knowledge that are covered in this law, and you should be aware of them as you are getting ready to embark on this career. Because as I've told you, and I will continue to tell you, this is a very important job. This is a very responsible job. Okay. So there are 3 different types of knowledge. Actual knowledge, knowing for a fact that the information is false. You're dead meat. Okay. And you should have those hairs on the back of your neck standing up if you know for a fact that someone in your facility is telling you to code something or report something that you know for a fact is not true. You need to stand up. And, you know, my first inkling is always to say maybe they don't understand that this is not legal. Okay. There are a lot of people that don't know. Maybe you didn't know until I just said it right now. Okay. That's why you're in school. But maybe they didn't take this class. Okay. So the first thing I say is share the knowledge and say, you know what? Doing that is illegal. We can't do that. And then the second thing I would say is if somebody asks you to do something that is illegal and you're afraid of getting fired, you need to, well, you need to do what you need to do, but you need to immediately brush up your resume and start looking for another job. Okay? Because once you are charged, it's going to be impossible for you to find a new job. And I just want you to think about this. Whether it's a physician or a supervisor or the practice manager, and they come to you and say, wink, wink, nudge, nudge. No, 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 no. We do this all the time. It's really okay. And you say, no, I learned in school this is not. This is illegal. And you say, oh, no, 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 no. No, it's okay. I promise you, we do this all the time. Okay. Do you think a person who would do that is going to be a stand-up person? So when the Office of the Inspector General brings you into court and charges you with violating the False Claims Act, do you think this person is going to stand up and say, oh, no, Your Honor, the jury, no, no, no. I told her it was okay. I told him to go ahead and this is my responsibility, my fault. Do you think they're the type of person to do that? Somebody who already told you, oh yeah, that's what you think, it's illegal, but we do this all the time? No. They're going to say, hey, I hired this person because they have the education and the knowledge of proper coding. I don't know anything about coding. I never took a coding class. I don't know about those things. That's what they're going to say. They're going to throw you under the bus. So let's not. Okay. Plus, let's remember that it's wrong. Okay. Then there is what's known as willful ignorance, which is basically, don't tell me, I don't want to know, just give me the information. If it says it in the documentation, that's all I know. I don't want to know. I don't want to know. I don't want la 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 la, that kind of thing. Okay. But this is where the should know comes in. Based on your job description, based on your education and your training, based on what you are required to know to have a job as coder, medical coder, or medical biller, or both. If you're required to know this, and by the way, the reason you have this class is because you're required to know this. So willful ignorance is not going to get you off the hook, because they already know you. I didn't know that, Your Honor. I didn't know. And they're going to say, but we're looking at your transcript. You learned this. So what are you going to say? Oh, I wasn't paying attention. I was absent that day, or sorry, no. It's part of your job description to know. So know and do. All right. And then the third type of knowledge is just a total disregard of truth or falsity. Just a total indifference to, well, these are the codes that the doctor hands me. And even though I have a coding manual that says, in accordance with what was written in the encounter notes and the code description, these two things do not go together, but this is what the doctor circled on the super bill. So yeah, you're going to prison. That's it. I don't want you to go to prison. I instead teach so that you all can go out there and make this part of the healthcare industry better. This is better. We have all this money in budgets and from insurance companies and from the government. And we have all of these millions and billions of dollars allotted for patient care and all different aspects. Let's just do our part to make sure the money is spent correctly and accurately and for the right things. It's not so tough. So let's go ahead and talk about 6 of the most common medical billing errors being, invisible quotes. Sometimes it's done by accident, sometimes it's done maliciously, whereas, the doctor or the RN or the practice manager or the supervisor goes wink, wink, nudge, nudge. Okay, and the first thing, and one of the most common, is unbundling. And you remember this from your CPT coding, how but even with ICD-10 CM diagnosis codes, but mostly with CPT codes, you'll have a code and the description is like a combination of things, okay? It includes the surgical removal of a lesion, and the description of the code says it also includes fluoroscopic or ultrasonic guidance, okay? Well, unbundling means you report the removal of the lesion and use a separate code for the ultrasonic or fluoroscopic guidance. Okay. But you know, because you were taught this in CPT class, that you are required to always use a combination code when it's available. So breaking them apart into two codes is in no way, no shape kosher. It's not legal. It's wrong, wrong, very wrong. Don't do it. Okay. Upcoding is reporting a code for a higher level of service than what was actually done. So if we look at a wound repair, okay, and you know how in wound repairs and CPT, there is a one code reported for less than 5 centimeters. And then the next code is for 5.1 centimeters to 7.5 centimeters. Okay. You report the one for 5.1 to 7 centimeters, even though the documentation says that the lesion removed was only 3.5 centimeters. So that's upcoding, is you're using a higher ranked and higher paying code than the one that was actually valid by what was done. Okay. Ghost patients. These are patients who, and this is most commonly done in patients who have like a regularly scheduled appointment. They may come in once a week for allergy injections, okay? Or sometimes in chiropractics where they have 10 visits, okay? And the patient doesn't show up, but they put through a claim for that visit anyway. No. Okay. You got to learn about your NCCI edits, because ignoring them is not going to make you very popular, or will make you popular in jail or prison. Okay. NCI edits look for 2 procedures that are reported at the same encounter that cannot possibly be reported at the same encounter. Okay. Or it could be you're saying that you did 3 of something when that's totally unreasonable and dangerous. Okay. Inaccurate modifier usage, you know, this is totally has to do with CPT, and modifiers modify. Okay. They modify the description of the code, and sometimes they provide a reason for the code to be paid at a higher rate, like increased procedure service, modifier 22, which is one of the most common fraudulent activities. Okay. And reporting unspecified or unlisted codes without supporting documentation. You can't just report that, particularly with diagnosis codes, because unspecified diagnosis codes do not provide medical justification for providing a procedure code. I actually did a consultation with a physician group, and they were reporting breast cancer unspecified, and their claims kept getting denied. And so I tried to explain to them that you can't report unspecified breast cancer. And the doctor looked at me and said, well, we don't do staging. We don't know whether it's stage 1 or stage 2. We don't do that. That's done by the oncologist. And I said, but that's not what the code is. It needs. The code just needs to know the location, the specific location of the lesion. And there's no way that you can diagnose somebody for a fact with breast cancer, with a malignancy, unless there was a biopsy done. And if you did a biopsy, you have to know where the lesion was. So who's going to pay for that? Okay. This is all paying attention and using the knowledge that we're teaching you. And it's important that you stand up for what you are learning here, because we are teaching you the truth, not some pie in the sky. And you have to find a place to work where you can be happy in a good, honest environment and not worry about the OIG, the Office of the Inspector General, coming in the door and shutting you down and taking you all to jail. Okay, so in case you are wondering if I'm being overly dramatic, I wanted to share this with you. You'll notice the date, November 16th, 2022, which seems like a long time ago because it was last year, but in actuality, it's exactly 2 months ago. 36 people in 13 different U.S. federal districts were charged with various healthcare fraud schemes. In this particular case, this was regarding telehealth. But you'll notice the second part. Defendants include telemedicine executives who allegedly paid doctors and other medical providers to order unnecessary laboratory testing, durable medical equipment, and other medical services. Okay. The fact is that everything is in the computer and all the computers are talking to each other. Stand up for what is right. And I am here to help you. Note this email address. The email address under class list in the course is incorrect. It's going to send your message to one of the rings of Saturn. Okay, so instead use this one, and then I can actually get the message, and then I can respond within 24 hours. And we can email back and forth. I can answer your questions. We can set up an appointment to speak on the phone. We can do a one-on-one Zoom. We can FaceTime, whatever. I'm here to support you so you can support a successful career. Okay? Thank you. Email me.